Hi, I'm Dr. Shane Creado. I'm a general psychiatrist, a sports psychiatrist, and a sleep medicine doctor. I became a sleep medicine doctor to better help my patients in psychiatry with their sleep issues. Just prescribing sleep medicines to my patients was, at best, shooting in the dark, and at worst, putting a band-aid on a festering wound. I really wanted to understand the underlying causes of their sleep disorders, understand the overlap between sleep and psychiatric disorders, and treat them with the best available tools we have in modern medical practice. Over 70 million Americans suffer from sleep disorders. In every major psychiatric diagnosis, there is usually a major sleep component as well. I had a patient who was suffering from really bad post-traumatic stress disorder, and he came to me because of sleep eating. He was not aware of this, but his partner would tell me that he'd wake up and eat a bunch of food and had gained 40 pounds in 8 months. We evaluated him, had a sleep study done. He in fact had really bad sleep apnea. He was stopping breathing over 100 times an hour during the course of the night. We put him on CPAP, treated his PTSD effectively, based on my experience in psychiatry and sleep medicine, got to treat his sleep apnea. His brain stopped waking up at night, so he stopped eating in the middle of the night while asleep. He lost weight, could go back to work, and continue functioning in society. There are things like sleep apnea and major depressive disorder. There's a 20% concordance between those two disorders. Because sleep apnea can look like depression. You have low energy, low mood, concentration problems, and you don't want to do anything. A lot of kids in today's world, especially in the obesity epidemic, are misdiagnosed with ADHD and put on stimulants, when in fact they may have sleep apnea. I help my athletes when they have to cross time zones, but also in improving the amount of sleep and the quality of sleep they're getting. There are studies that have shown that improved sleep can improve your memory, can improve your athletic performance as well. They've improved tennis serving accuracy and basketball shooting accuracy as well through adequate sleep. In the veterans population, the most common disorders treated are high blood pressure, obesity, heart disease, diabetes, sleep apnea. But sleep apnea can worsen all of those disorders, and treating sleep apnea effectively can improve the quality of your life. Did you know that melatonin is not supposed to knock you out? It's just supposed to nudge your brain into sleepiness. It's often misprescribed, it's often wrongly dosed, and it's often used very inappropriately. Did you know that even if you're getting 8 hours of sleep at night, it may not be the best for you, because you may be needing 9 hours of sleep a night, and at the end of the week, you'll actually be sleep deprived by 7 hours, even if you're getting 8 hours of sleep a night. In modern sleep medicine, we don't view insomnia as a lack of sleep, but rather excessive wakefulness of the brain. And I can work with my patients on how to calm their brains down to get them better quality of sleep. If you're sleep deprived, there's a hormone called leptin which is reduced, which may actually force you to be hungry and eat more and make you gain even more weight. So if you or your loved one snores, wake up like you feel like you've been hit by a truck, always have disrupted sleep during the course of the night, or are feeling sleepy during the day, if you're thrashing around at night and hurting yourself and don't know why, if you're afraid that your partner is stopping breathing at night or snoring so loudly that you have to sleep in another room, if your kids can't go to bed at night, can't wake up on time, there is hope. You spend a third of your life sleeping. Let's make that time well spent. Thank you.